For more on flattening the curve, Dr. Nkem Ene, she's the co-chair of the Health Sector Reform Coalition and CEO of Preston Associates for International Development. She joins us from our Abuja studios. Thank you for joining us on the program.
It's a pleasure to be here.
Now, Dr. Ene, you've been involved in the pandemic response for some time. What's your assessment of the priorities for government as it combats the rising case of COVID-19?
Well, I would say that the two top priorities would be testing. It's important that we test more people. Currently, we have 272,000 being tested out of a population of 206 million. That's about 1.3%. That's nowhere near the recommended first milestone of testing, which is 10%. And then, of course, it needs to go higher. So without really getting a real sense of what's happening in the country, it's difficult to say whether the government is doing a good job or not, or whether, we're approaching the curve, or whether we're flattening the curve. We don't really know, because right now, we haven't tested enough people. Then I would say the second priority is really about messaging. The messaging needs to be effective, really, at the grassroots, because we're seeing that while those in urban centers may have heard over and over about the COVID virus, in the hinterlands, in the rural areas, hard-to-reach areas, that's not the case. Some people don't even believe that COVID exists. So I would say that messaging is a big part of what the government really needs to be coordinating at this point. Thank you.
In monitoring the efforts of government, looking at the percentage of, the high number of unknown exposure of the virus in our communities, is there a possibility that the virus was already in the country before our first confirmed case in February?
The thing is, once the first case was identified, when the cases were identified in China, I think our government did kick into gear. I think the head of this NCDC was quick to kind of raise the alarm that, Nigeria could be next. So I think there were some systems in place at the airports. And the first case that we had, which was actually not a Nigerian national, but somebody who was coming from Europe, who was working here. And we were quick to, at least they were quick to, identify this individual, have him confirmed as a COVID case. And, all the protocols for surveillance and isolation treatment were just kicked into gear immediately afterwards. So it's true, there's an incubation period of about 14 days. A lot could have happened before that. It's possible that other people who went to China came in, but just didn't make themselves known to authorities. But, where we are now, we don't know how much of that, what we're seeing now, is attributable to the cases that were not known in those early days.
So moving forward, tracking the virus, the trends, what should states and the federal governments be doing?
I think they are doing, I think from the national level, I think a lot has been done to set up the framework that states are supposed to follow. But now that we're at the stage of community transmission, it's really not up to, the folks at national levels. This now, at the state level, that the governors really need to be aggressive about, trying to arrest transmission. Those ports of entries, those interstate boundaries, the testing rates, all of that needs to be aggressively pursued. I'm not sure that, I know that contact tracing is still going on, but that's something that really needs a lot of effort. I think that if we take testing to the people, as opposed to expecting people to come to the test, I think we'll be able to get a better grip on what's truly happening. Right now, the testing is kind of prioritized for those who have symptoms, and that's not good enough. We should, at this point, be, particularly at state level, testing those that don't have symptoms. Take the test to the people and get those numbers up. Rwanda and Ghana have been quite aggressive about this and have, like you said in the earlier segment of this update, that they're doing pool testing where several specimens from various people are put into the same tube for testing. And if every contributor tests negative, then that's like another 5 or 10 people you don't have to test again. But if one of them tests positive, then you have to go back and do individual tests. So it's a very quick way to really ramp up your testing numbers. So I think testing is really the core of what needs to be happening now, so we can better understand what's truly happening behind the numbers that we see every day.
All right, we appreciate your time. Thank you so much and your insight, Dr. Nkem Ene, co-chair, the Health Sector Reform Coalition. Thank you for joining us on the program.
Thank you.